Okay, thanks very much for the introduction, Amy. So, as the title says, I'm going over our report that I wrote last year, laying out our new future for dog breeding and the Breeding for Health framework that we are working on through 2026 and going forward. So this is going into more detail on some of the things that I mentioned in the recorded presentation I gave yesterday. And I will be talking obviously in part about our approach to confirmation related issues, but it's a bit more broad context than that because I'm setting the sort of backdrop more broadly. So, starting off with a new future for dog breeding. So, this is a major report from the RKC that was published at the start of this year. When I joined the organisation at the start of 2025, this is what I mostly did during that year. And if you've not read the report and you would like to, then it's downloadable from the link that I've given on this slide here. So the title may be familiar to some of you because it's intentionally the same as the title of this paper, which coincidentally was published just as I started this work in January 2025, which is obviously a multi-author paper, including many names that are familiar to us within IPFD. And this paper was largely laying down a challenge to kennel clubs internationally, saying that they had not done enough to address issues related to pedigree dog health and what were they going to do about it. So given that looking at this was my remit at the time, I thought we might as well meet this challenge head on and use the structure that these authors had laid out in order to answer their question. So Hella Proszkowski and her co-authors divided issues related to pedigree dog health into these three categories. This is obviously not new, that we are all very familiar with these categories in this world. But how we address issues related to reduced genetic diversity in breeds on closed or nearly closed breed registers, how we address extreme conformation, and how we address other sorts of breed-related disease are interconnected, but to some extent separate challenges. So I conducted this review process with quite extensive consultation with various sources of expertise within the UK. I ran 3 parallel breeder focus groups and also incorporated insights specifically on issues related to genetic diversity that had been harvested by my colleague Dr. Joanna Ilska at her population analysis workshops, which she was running in parallel early last year. I had group sessions with external experts, academics, veterinarians on the front line, and a few one-to-ones with pedigree dog health campaigners as well, so that I was canvassing a range of opinion. And this is a sort of brief overview of where these various stakeholders agreed and disagreed. So thinking first of all about genetic diversity, it's unsurprising that pretty much everybody recognised that inbreeding and loss of genetic diversity is a major issue in many breeds, and that there are various reasons for this, with popular sires highlighted as one of the major concerns, and that the RKC should be providing more leadership, education and engagement in this space to address these issues. Stakeholders, however, did differ in particular concerns according to their perspectives. So the breeders that we spoke to, unsurprisingly, had specific issues with our governance and regulation, one of the big ones being the misleading issues caused by shallow pedigrees on the RKC database, particularly when dogs have a number of imports on their pedigrees, and imports customarily coming from one country to another only have 3 generations of pedigree, which means that more remote common ancestors that may contribute significantly to high coefficients of inbreeding are not recorded. Unsurprisingly as well, the external experts and campaigners we spoke to were strongly in favour of outcrossing where needed. Most breeders were neutral about this overall, which I thought was an interesting discovery because I suspect that 10 or 20 years ago that wouldn't have been the case. But broadly speaking, most breeders basically thought that if a breed community wanted outcrossing, that was fine, but not necessarily relevant to them within their own breed. And then there were a small minority of breeders who were extremely strongly pro or anti outcrossing for their own breed communities. So overall, this gave us an impression of customized solutions and approaches being really important to address this issue, as Joanna will be discussing later. Then moving on to extreme conformation, just to briefly show you the definition that we used. This was developed by us as part of the Brachycephalic Working Group, and it's a simplification of the international ICE-DOGS definition in a form that we have generally found more appropriate for use with breeders, that basically extreme conformation is conformation that is impacting health and welfare, reducing quality and/or quality of life. So if a conformation isn't doing that, then it's not extreme. And if it is, then if it does, then it is. Of course, sometimes the devil is in the detail of how you know whether a sort of intermediate conformation is having an impact, but that's something that we're unraveling with the work we're doing now. Where did stakeholders agree? Everybody agreed this was a difficult issue. The breeders that we spoke to were generally satisfied with the approach we currently take in the show ring, but with some caveats about the details of that, and with widespread agreement that more subtle issues such as conformational creep might be overlooked. Again, most breeders didn't comment much on extreme conformation, except for those in breeds where it's already acknowledged as a problem. Again, otherwise, most of the breeders we spoke to seemed to feel it wasn't really anything to do with them. But this investigation was conducted about 6 months before the launch of the innate health assessment in the UK, which has utterly transformed people's awareness of this topic if they're not in a breed that was already engaged with it. For external experts and campaigners, they were already, unsurprisingly, very concerned about this and very keen to tell us what an impact it has on our reputation, and told us that we should be doing far more about it. Moving on to breed-related disease, this is health testing for health-related conditions, breed-related health conditions more broadly, which I'll come on to in a moment. Our provision was generally considered comprehensive but inaccessible or little known to novices and the public. The health standard, which I'll be describing towards the end of this presentation, was generally well regarded, but they thought that we should be providing more incentivization for health testing and better leadership on this. There were a wide range of views on where we should sit with regard to mandatory health testing. There was a consensus that breeders with different knowledge levels need to be approached very differently. Someone who's been deeply involved in a breed community for 40 years is absolutely not in the same space as someone considering breeding their first litter, and that we should be doing more to engage with those breeders that we can reach who don't care about health. So overall, there was a very strong focus on us doing much more outreach with listening, which we certainly have started to do subsequently, and to be much more proactive about leadership in implementing new solutions, which I hope you will see we are also trying to do. So this infographic, produced by my talented colleague Eloise, summarises the investigation and research process and the feedback that we received on the top half of the infographic. And the lower half of it explains the output that has resulted from the report with the Breeding for Health framework, which covers the various aspects of health and welfare that we think should influence the breeding choices for any breed or type of dog, and also feeds into how we think that engagement with this can be deployed through a grouping concept where appropriate. So this is our Breeding for Health framework, and you'll recognise those three Proszalski categories of genetic diversity, conformation and breed-related disease as the three vertical columns here, and three areas to be considered under each of those three headings. I'm not going to engage at all here with genetic diversity because Joanna will talk about that. And only briefly with the lower grey areas, because I've not the time to cover all this in detail. I just want to draw everybody's attention to the point that we have included temperament and mental well-being on this as something to be on the table for future provision, although that's not something we've got the capacity to engage with specifically immediately. So just to briefly outline how we envisage the grouping concept. So let's suppose we have these four fictitious breeds, A, B, C, and D. And let's think about breed A. Let's think that breed A is perhaps a dog with a very small global population with very high levels of inbreeding. It might also have brachycephalic conformation, and maybe if it's particularly unlucky, the breed is also struggling with a high prevalence of a specific inherited disease. How are we, as a small health team dealing with now 227 different breeds, got the capacity to support breed A with these three very different problems? Through the grouping concept. So let's say that breed B has a similar structure of a very small global population with high levels of inbreeding. We can group A and B together for mutual support and address them together to discuss how they might approach that problem. Let's see, we're thinking about particular issues related to brachycephalic health, then we can group breed A with breed C and the other brachycephalic breeds so that they can have mutual support and customized attention for that concern. And let's say that breed A and breed D happen by chance to have the same specific inherited disease. No matter how different they may be in other ways, they can be grouped with other affected breeds as we approach that specific problem. So you can see that the grouping concept allows greater support for a more efficient workload from us and is a key aspect to deploying the Breeding for Health framework. So just to briefly outline our 2026 work streams under this framework. Under genetic diversity, we are going to be providing support for numerically small populations. Under visible conformation, we're developing the nose-to-tail veterinary visual assessment. And under breed-related disease, we're starting to develop a mandatory health testing process building on the existing health standard, which is a breed-to-breed, breed-by-breed guide to health testing priorities. So something has happened to my interface there and I've lost control with the mouse, which is troubling. If I click that, will there be a disaster? No, great, lovely. Okay, sorry about that. I'm not going to talk at all about genetic diversity because Joanna is going to be presenting on that a little bit later on this afternoon. So moving straight on to the nose to tail, this is our approach to addressing extreme conformation. So this is filling a gap in our previous health provision, which we have not really engaged with effectively before, except to some extent in the show ring, as I mentioned. This will be a veterinary assessment, which will look at the visible conformation of the whole dog in a format that is applicable to any breed, though obviously of more relevance to those that have issues with extreme conformation. And it's evidence-based to consider exaggerations of body shape that have a welfare impact in a way that is standardized, nuanced, and repeatable between assessors, between dogs, between breeds, so that that allows us and breeders to collect data that can be used to monitor progress. So we're currently in the middle of developing it. This is my main work at the moment. So far, we've had a series of focus groups with over 20 vets involved overall who have contributed their expertise voluntarily to support in developing the format and criteria that we're currently working with. We then moved on to a focus group phase with breeders, where more than 200 breeders that we've recruited from right across the spectrum of breeds, including those with more and fewer conformational issues, have given their input and provided some really valuable feedback to things that we all were already aware of as possible issues and things that we hadn't thought of at all before. Currently, I'm wording the draft boundaries of the different criteria that we've drawn up. Once those have been refined through another round of feedback with breeders from certain key groups, we're going to move on to pilot that this summer at dog shows with actual dogs. We'll refine it again with further feedback after that before a soft launch in November 2026. There'll then be a bedding in phase before full deployment in the same way as our other health testing provision. There are a number of things that the nose to tail assessment isn't. So it only looks at visible body shape and to some extent movement and other aspects of things that you can see, such as colour, will be addressed later where necessary. It's only a visual and manual assessment, so other aspects of a physical clinical examination that a vet might carry out, such as cardiac auscultation, are not included. We've got good reason for that. If during the assessment process, a breed club would like the assessing vet to add something like cardiac auscultation on, that's fine, but it's not going to be part of what we formally record under this process. It's important to stress that it neither includes nor substitutes for other health screening tests such as hip scoring or DNA tests. It's filling a gap that they don't fulfill, with a very little overlap in a couple of areas, rather than being something that's intended to replace one of those tests. And in contrast to the show vet checks that are carried out in the UK under the BreedWatch system, it does not focus on clinical signs of disease related to conformation, but rather on the underlying conformation itself. Finally, we've deliberately designed it not to be a pass-fail system, but a more gradated system that can be tailored to the starting point of each breed to support and encourage improvement where that's necessary within that breed. So how will it work? There are currently 15 draft criteria. That may still change, and I'm deliberately not outlining those criteria in detail today, not because we haven't drawn them up, not because they're a secret, but because we're still very much at the overview level where we're presenting this externally. We want to share the information that we're pretty certain of, rather than the information that's still provisional. There's obviously an evidence base for the inclusion of them all, and they divide basically into those that are assessed visually, where the vet will be going, okay, I think this is this grade for this visual attribute, and those that will actually be measured with a tape measure, and that measurement then used to construct a ratio that will then fall into the grading system. All or most of these criteria will be graded from 0 to 3, where 0 is totally normal and 3 is the most extreme version of that criterion. And that then means that by adding up the scores that an individual dog has obtained for each of the various criteria, you can create a total for that dog, which in theory can range from 0, if the dog scores 0 on every single criterion, to 45 if there were 15 criteria, or whatever the total might be. Now, it's important to stress that we don't intend or think that any dog would be unfortunate enough to actually obtain 45. And if it did, its conformation would be beyond horrific. It's just that that's the theoretical total under this system. And that, therefore, obviously, once you've had a few dogs scored of a certain breed, gives you the potential to create a breed average in the same way as we do with the hip scoring system in the UK. And that then means that you can compare breed averages between breeds and see which have a greater or a lesser problem with extreme conformation, and that you can compare breed averages within a breed over time to monitor change. You can also obviously pull out certain criteria individually, potentially, to monitor certain criteria more closely if needed. So if you're particularly worried about a certain criterion in a certain breed, you could look at that one individually and track that in a similar way. What will it look like? I've described how the grading system will work. This is an example that we will be lifting straight from the respiratory function grading scheme, because we will be including nostril grading in the nose to tail. And since the Cambridge team have already created a beautiful system for this, there's absolutely no reason for us to reinvent the wheel, and we will be using this system. So this is how it would work, that, for example, on the top row there, where the open nostril row has been drawn up, we would just call that grade 0, and the bottom row with severe stenosis would be grade 3, and the vet will be placing each individual dog wherever it fits within this matrix and giving it the appropriate numerical grade. It's really important to stress, as we have done with the breeding community, that the assessment of any dog can follow the same standardized process. There is no need for the vet to be familiar with the breed standard of that breed, because they won't be referring to it. They will be using the framework to evaluate the dog in front of them, irrespective of its breed. However, we neither expect nor intend that every dog of every breed should be scoring 0, because certainly some ones will indicate acceptable breed variation. It's not possible for every numerical value to have exactly the same welfare impact across every criterion, because we're talking about biology. But in many cases, ones are not necessarily going to be associated with an evidence-based welfare impact, but just with variation that is not so extreme. So here are some very rough fictitious examples to show you how it would work. And it's important to stress, firstly, that, as I've stated, the criteria are not yet definitive, the boundaries are not yet definitive, and very importantly, I haven't actually handled any of these dogs. I've just looked at some photographs and drawn up the examples to be illustrative. So these are a work of fiction, but they just show you how it would work. So on the left here, obviously, we have a working type golden retriever where there would be no issues with its conformation whatsoever, and that dog would be expected to score 0 out of, in this case, 42, because we have not included movement in the criteria here, because obviously you can't assess movement on a photograph. In the middle, we have a boxer with very moderate conformation, surprisingly a boxer in Iran from Wikimedia Commons, and I've given this dog a representative score of 6 out of 42 through going through the criteria and giving it a number of 1s on the basis of the picture that we can see. On the right, of course, we have some hyper extreme bulldogs, which are far more extreme than anything you would see certainly in the RKC show ring today. And even these dogs are scoring approaching 30, but not up in the high 30s or the 40s, even though clearly their conformation is massively compromised. But I think we can see that this scale does work pretty well for differentiating between more and less extreme conformation in a way that hopefully will be really valuable to help drive change over time. So that's the nose to tail, and then I'm just going to briefly finish by quickly addressing how our approach to testable conditions, the third column of the breed-related disease column under the Breeding for Health framework, will be changing during 2026. So this is what I'll be moving on to working on later in the year. So for those who aren't familiar with it, we already have the health standard, which was launched in January 2025. And that's an evidence-based guide to the important testable conditions for each breed, divided into the good and best practice levels. So good practice is what we would hope that any responsible breeder would be doing for that breed. And best practice is the additional test that we would expect breeders aiming for the highest standards to carry out. And there's an algorithm for both phenotypic tests and DNA tests based on the prevalence of the condition in the UK and the statistical evidence for it that we use when deciding whether to put tests onto the good or best practice level in the framework. So just to show you some of the most popular breeds slightly larger so that you can actually read it, you can see that, for example, for the bulldog, they're expected to carry out respiratory function grading scheme testing and eye testing at the good practice level and a number of other tests at the best practice level, and so forth for all the other breeds. Now, these are the tests that are listed in the health standard. I'm not going to read out the slide, but these are the clinical tests that we include, and then DNA tests that we include are those that meet the evidence threshold that I've just indicated for each breed. So it's meant to guide people towards the tests with more of an impact rather than them getting lost in the woods of some tests that may have a lower impact in that breed population. But we know that there are a number of issues with health testing provision currently. Importantly, particularly for the clinical schemes, uptake is disappointingly low across most schemes and most breeds. There are specific issues with some clinical schemes that need some level of revision. And also there are problems with what we include on the health standard in various ways. First of all, we rely on peer-reviewed published evidence, but we know that that overlooks rarer diseases in rarer breeds because not every disease makes it to publish peer-reviewed evidence. So we need a more sophisticated way of assessing that. Also, the health standard doesn't yet include disease severity, which is obviously really important. A disease that has a huge impact on a dog's quality of life or that causes its early death is obviously far more serious than a disease that might cause it to lose some vision in old age. And yet the health standard doesn't really differentiate on that basis. So we need a severity index. And once we have those things in place, we have the groundwork that we need to work towards developing an algorithm for mandatory disease testing decisions, because obviously there's powerful calls for us to introduce mandatory disease testing for RKC registered dogs, but it would be impossible to require that of every disease in every breed and would be counterproductive to do so. So we need a prioritization algorithm, and that will give us the materials that we need to develop that. So that's what we will be doing in 2026 and moving on to 2027. Evidence for disease severity index, and an algorithm for mandatory testing decisions. So we have our work cut out going forwards, but it's well planned and we're really excited to get through it and develop those tools to help breeders to produce dogs that are healthier. Thank you very much. Looking forward to the questions, or send me an email after the event.